My grandfather, when I was about 10 years old, was diagnosed with esophageal cancer. And so he spent 10 weeks in one of our teaching hospitals here in the city, getting a complete laryngectomy and learning to talk, having a stoma, and we spent every night in the hospital there. So I watched nurses, I watched how they took care of him, I watched how they changed his day. And then I took care of my mom for most of my life. She had end-stage COPD, had a lung disorder, so it was helping her all my life, that I think keeps me motivated to help others. I've done burn ICU, I've done pediatric ICU, open heart, neuro ICU, transplant, all of these areas I've done, and ER as well. And I think that you make a difference. I think that if you think back in your life, maybe when something happened to you, or maybe when your children were born, you'll remember maybe that one nurse that really made a difference, that you couldn't have gotten through that without them. You never forget that moment. And I wanted to do that for others too. I was told by a nurse that worked at St. Luke's that I would get better clinical skills and enrich my nursing career if I wanted to go back and learn nurse practitioner type skill sets and thought processes. I too went back to the same program because I trusted it then, and I believe in it now. I don't want to be limited that I can only take care of the adult or the aging population. I want to be able to be in a facility that can treat both, all of them, because more so the acute care is looking at the sickest of all patients, and the family nurse practitioner degree, that is really looking at how you're going to put people back into the community. It's wellness, it's health promotion, it's immunizations, it's eating right, it's those type of things. So putting the whole thing together, I think, makes a good rounded, hopefully, nurse practitioner. St. Luke's, as well as the combination with Rockhurst together, they're going to give a very complete education. I believe that God created us. I believe that it couldn't be more perfect to have that combination of education and godliness together, the spirituality component. They're going to follow up on what they say they're going to do. They're going to keep checking on you. And if you were to have any questions or have concerns, they're there. You're not a number. You have a name. They know who you are, and they care about you.